Signs and symptoms of colon cancer that you shouldn't ignore. Colorectal cancer, also called colon cancer, is the third most common type of cancer in people. Even though it can be managed if caught early, if it goes untreated, it can kill you. In fact, it is the second top cause of cancer deaths in both men and women in the United States. When cells in your large intestine start to grow in an abnormal way, this is the first sign of colon cancer. These cells can grow into polyps, which can turn into dangerous growths. If this happens, they can travel through your lymphatic or blood vessels to other parts of your body. Colon cancer can also start with a colon adenoma, also called a flat polyp. This is not cancerous growth, but it can turn into one if it gets bigger or turns into an adenocarcinoma, which is a cancerous tumor. Risk factors. Most people with colon cancer are over the age of 50, but anyone can get it. Colon cancer or polyps are more likely to happen to you if someone in your family has had them. You might also be at risk if you have inflammatory bowel disease. Eat a low-fiber, high-fat diet, don't move around much, have diabetes, are overweight, smoke, or drink alcohol often. Symptoms. Colon cancer symptoms vary from person to person, but there are a few common warning signs to look out for, such as your stool, bleeding from the rectum or blood in your stool, persistent abdominal discomfort, such as cramps, gas, or pain, a feeling that your bowel doesn't empty completely, weakness or fatigue, loss of appetite, and weight loss. Now, these symptoms can be caused by a number of things, and in the early stages of colon cancer, many people don't have any symptoms. When symptoms do show up, they can be different based on how big and where in the large intestine the cancer is. That's why it's important to get checked regularly. It can find colorectal cancers and even avoid some of them. Detection. Your doctor will probably start by looking at your private parts. You may also have a colonoscopy, in which a blendable tube with the light at the end is put into your rectum. This lets the doctor see what's going on inside your colon. A fecal occult blood test is often also needed for screening. This test looks for secret blood in the stool, which is often caused by polyps or tumors in the colon. Your doctor may also order more tests, such as a CT scan, which uses X-rays and a computer to make detailed pictures of the inside of your body. An ultrasound, which uses also sound waves to make pictures that shows the size, location, and the shape of the tumor, if there's one, as well as any abnormalities in the tissues around it, and a biopsy, in which they take a small piece of tissue and look for cancer cells. Treatment. Surgery, radiation therapy, chemotherapy, targeted therapy, immunotherapy. These are all the possible ways to treat colon cancer. The kind of treatment for colon cancer depends on what kind of cancer cells are in the colon. Prevention. The good news is that you can change some things about your life to lower your risk of colon cancer. Follow these steps. Eat a variety of fruits, vegetables, and whole grains. They have important vitamins, minerals, fibers, and antioxidants that may help avoid cancer. Drink alcohol in moderation. Stop smoking. Try to exercise for at least 30 minutes every day. Stay at a healthy weight. In the end, it's better to be safe than to be sorry. So, do everything you can to lower your chance of getting colon cancer. Make sure to get regular screening, and if you think you might have it, talk to your doctor right away. If you thought this video was helpful, give it a thumbs up and tell your friends about it. If you want to see more videos from us, click the subscribe button and turn on notification for more video updates. Thanks for watching.